especially with some of the data that shows vitamin K2 can improve your basically vascular flexibility, so the ability of those arteries to contract and dilate. There was a trial that failed. And up next we have vitamin D. We kind of lump this together with vitamin D and K2 because we are often having people take both of these together, particularly in the case of statin use. And this is one of those interesting things where you see a paradoxical effect with statins and an increase in vascular calcification, which is good because it stabilizes unstable plaques. But ideally, you don't have any calcification. So it's kind of a double-edged sword there, and potentially vitamin K is something that plays a role here. So vitamin K2 is depleted, if you will, just like CoQ10 in people who are on statin therapy. And again, I think it's a good idea to replace those things, especially with some of the data that shows vitamin K2 can improve your basically vascular flexibility, so the ability of those arteries to contract and dilate. There was a trial that failed looking at aortic calcification. Vitamin K2 did not seem to have a beneficial effect there, but it doesn't appear to have harmful effects either. Not to say that no one can have a side effect from vitamin K2, but it seems to have a fairly good safety profile, just like vitamin D, but there's also risks with vitamin D. So should everybody be taking vitamin D? Should everybody be taking vitamin K2? Or who are the people who stand to benefit the most from those?
As always, we're a fan of checking objective markers in your labs, and we will post lab panels and such on our website at some point with all these things, CoQ10, even carnitine, vitamin K2 as well, in addition to vitamin D, which I think most people interested in health optimization check regularly. But a bad candidate for K2 would be potentially someone who is on a medication where you're not supposed to take vitamin K with it, or if you go to for example, an anticoagulation clinic, talking to that specialist about vitamin K, because it is both, it's involved in protein C and protein S and other coagulation factors, so it can both lead to bleeding and clotting depending on the timing that you're taking it. So if you have one of those predispositions, that's when to consider your vitamin K intake more closely.
And vitamin D, people can check this quite easily. I think insurance does pick up this one on occasion, although based on my providers that I've talked to, you do have to change the ICD-10 every once in a while because they stop covering for vitamin use. Now it has to be long-term medication use or something like that. But you can also get it from a self-service lab company quite cheaply. And there's different levels of vitamin D that correlate with a sufficient level, a deficient level, and a insufficient level. So when we're looking at a vitamin D level below 20, that's typically defined as a deficient level. Below 30 is insufficient, and then anywhere between, typically it's 30 and 100 is considered a sufficient level. But what do the data tell us about the level, and should someone be at 31 and they're good to go, nothing to worry about, or should somebody have their level at 200, just get it as high as they possibly can?
Yeah, so vitamin D, it can be over 100, but if you're using sunlight and diet to get it to, let's say, 130, then I'm going to have less concerns than if you're just using supplementation to get it there. Vitamin D, D, A, K, and E. So cake with a D are your fat-soluble vitamins, and they all can potentially have toxicity because they build up in high levels. That's why if you eat, for example, a bear liver, then it can potentially be toxic. I think particularly polar bear livers, but I could be wrong. Polar bears are mostly carnivorous, and they have higher intake of fat-soluble vitamins. But not to get off onto too much of a tangent, the vitamin D intake, I consider optimal range would be around 40 to 100. So if I was 31, then I'd say definitely supplement. There's some studies, there's lots of studies on vitamin D out there, but I think there's some pretty good ones that show improved immunity at a level of 40 or more. Some physicians say 50 to 100, for example, in a patient with osteoporosis.
Yeah, and if somebody has a family history of autoimmune disease, this is another area that we see vitamin D having some association with a reduced incidence. So, let's say something like Hashimoto's, very common. Female patient comes in, mom, about my age, developed Hashimoto's. Well, we can check those, antibodies, check the thyroid labs, but then also pushing up the vitamin D level closer to that high end around 100 could potentially be better than if it's just at, let's say, 31 and you're sufficient. Another thing is, it seems that when you push that level across a threshold of 50, that you have an improvement in athletic performance. And again, it's not going to be better than just consistent training and progressive overload. But this was noted in, I believe, some European countries where they saw variations in athletic performance depending on the time of year and then the sunlight exposure. And we know that sunlight does trigger that cascade and help with the vitamin D synthesis. There's been a couple trials that have looked at this. They've looked at soccer players and their vertical jump. They've looked at judo contestants or combatants, I'm not sure what the right term is there, and their isometric strength. And they do see some statistically significant changes, but again, it's a fairly small effect size. And a great example of this, something that I used to think was, vitamin D, very protective for pancreatic beta cells. And I was actually misinterpreting that study. When I went back and looked at it, it was just one small, I believe it was the hyperglycemic insulin clamp study that they were able to show that it did have a slight effect on the amount of insulin that was able to be produced, something of that nature, statistically significant, but not necessarily clinically significant. Mm-hmm. But then when we look at another study, which I was just glancing over before we started this, you can have something that is not statistically significant, but that seems to be and appears to be very clinically significant. So this was a 8-week trial where they supplemented vitamin D in one group, placebo in the other. And these weightlifters in the vitamin D group added about 9 kilograms, which is almost 20 pounds to their squat. And then the placebo group only added 3 kilograms to their squat over the same time period. Very big difference, especially for anyone that does compete in powerlifting or has any knowledge about what the difference in weights there are. That's significant. Mm-hmm. So I'm wondering what the threshold would have been to show a statistically significant effect size. Would somebody have to add 50 pounds to their squat in 8 weeks for it to be statistically significant? Mm-hmm. So I think there are some benefits there just related to your muscular function, having the level a little bit higher. But you do want to keep an eye on calcium levels, perhaps. Mm-hmm. If you have history of kidney stones, it's one of the most painful things people can experience, and you definitely don't want to predispose yourself to that.
Yep. The athletic benefit, and our friend Dr. Henry, Harvard-trained orthopedist, founder of the Vitamin D Society in Indonesia, he would point out that yes, the benefit from going from 10 to 50 is profound when it comes to athletic performance. The benefit from going to 50 to 100 might not be clinically significant, but it can potentially be helpful. And a lot of times he pushes people to the high normal, just like often we push patients on, for example, TRT that aren't feeling good at a low range testosterone up to the higher normal range as well. And he also points out that just because you're in an area with a lot of sun like Indonesia or the southern United States, you should still check a vitamin D, especially because depending on your dermatotype or basically how well your skin absorbs vitamin D, then you might tend to run low even with a decent amount of sunlight.
Yeah, that's a great point. And I've seen people who work construction in Arizona with insufficient or deficient levels of vitamin D. Mm-hmm. So again, it goes back to get tested, look at the objective data.